Good morning, everybody. I'm Abby Bronson. If you don't know who I am, I'm the SVP for Research Strategy at Parent Project Muscular Dystrophy, and I love this meeting. I'm so happy to be here. I love hearing about the progress that all the trials have made, CARE has made. So I hope you're all invigorated from the 0.1K run. And I'm here to moderate the first of 4 sessions, giving you all the updates on the clinical trials that have been going on in the past year. But first of all, I want to do 2 things. Every year, I think you all got a chance to see all the posters that are outside, and we usually do have a poster review session, and then we announce some winners, and they do a stand-up presentation. This year, we've done it a little bit differently. We included we're trying to involve you, the community, much more. So we had a community relevance statement. I don't know if you noticed that on the posters, trying to talk about why this particular project or idea was important to the Duchenne community. We had a much broader selection of people on the review committee deciding who were the winners. And in the past, we've had the winner do a stand-up presentation from the podium. And what we decided would be more important is that we have more, quote, winners. And at lunchtime today, they'll be standing by their posters. And if you have any questions, they'll be ready to do a mini 5-minute presentation on their topic. And if you are interested, you want to ask questions, you want to meet this researcher or scientist, they will be standing by their poster. So it's just a little bit more intimate way of bringing the researchers and the community together. So I want to thank all the 40 poster presenters that we had that submitted posters. And the winners are, the first one is under the robotics section. It's evaluation of a robotic arm support to increase independence for individuals with Duchenne muscular dystrophy, and that's Madeline Corrigan from the New Jersey Institute of Technology. And if she's here and she just wants to stand, and I'll announce all 5, and then we can hold the applause for the end. Maybe she's not here, I don't know. The second one is alternative exon skip repairs of the same DMD defect equivalent, Nick Menhart. I don't know if he's here. Great. The third, application of a CRISPR-Cas9 gene editing therapy in a novel humanized dystrophic mouse model of Duchenne muscular dystrophy. Courtney Young, I think I've seen her. I don't know if she's in the room. Congratulations, Courtney. Preclinical studies of WAVE 210201, an investigational stereo-pure antisense oligonucleotide for the treatment of patients with Duchenne muscular dystrophy, amenable to exon 51 skipping. That's Nayantara Kothari from WAVE. I don't know if they're here. And the last one is MOVE DMD phase 2 trial of etasalenexanet. I congratulate myself every time I can say that. An NF-kappa B inhibitor in 4 to 7-year-old patients with Duchenne muscular dystrophy, Joanne Donovan from Catabasis. So applause to all our poster winners. And during lunch, please travel around to those posters and learn more about what they're looking at. The second thing I want to do before we start the clinical trial update section is Duchenne Connect, our patient registry. Just this week, we launched a new section. It's called Exploring Clinical Trials. If you go into the website, this is a picture of it. You can see at the top, the Clinical Trials tab is highlighted, and that's where you're going to find all this new information. And there's a video I want to play, because one part of this new section of the website, can't do it with my left hand. Hang on a second. Oops. There we go.
Thinking about joining a clinical trial? It's an important choice. This video is to help you make the right choice for you. A clinical trial is an experiment. It tests whether the potential treatment works and is safe. It may add important scientific knowledge and lead to new advances, but it is not meant to help any one person. Some people may benefit, but others do not. Clinical trials measure benefits and risks over time, but you have to choose at the beginning, when the benefits and risks are still uncertain. That can be hard. No trial can promise a benefit. In most trials, most people don't get better. But that doesn't mean you can't benefit. Your health could improve. You may have other positive experiences, like feeling good about helping others or being more hopeful. These are also important, even if they don't improve your health. Different trials have different harms, such as being hurt, having side effects, or needing procedures like a biopsy. Other issues include travel, time away from work or school, and having less time for other activities important to you. Some people also worry about missing out on other trials. Though joining a trial can be rewarding, it is a big commitment. Try to imagine what it would be like. Ask questions about the commitment. How long does the trial last? How long is each visit? What happens at each visit? Do you have to pay any trial costs? Also ask what happens at the end. Being in a trial does not guarantee you'll get the treatment after a trial stops. Some trials use a placebo. Placebos help researchers understand if benefits or risks during the trial happen because of the potential treatment or happened by chance. Placebos are non-active alternatives, like a sugar pill. In most trials using a placebo, people are randomized by chance to the placebo or the treatment group. You would not know which group you are in. Often, people who start on placebo get the treatment later in the trial. You can decide if a placebo trial is acceptable to you. Are the possible benefits of a trial worth the risks and burden? Only you can decide. Learn all you can from doctors, researchers, and other trusted sources. Talk to other people about their experience in trials. Weigh day-to-day requirements, potential risks, and potential benefits. Take your time. Decide what is best for you and your family. If you are deciding for your school-age child, explain the trial in an age-appropriate way and get your child's input. Trials can lead to new advances, but joining is your choice. No one should pressure you, and anyone can leave a trial at any time. Thank you for considering being in a clinical trial. Learn more about clinical trials on DuchenneConnect.org.
So I just thought that was, if you were here at the panel yesterday, a lot of those issues were discussed, so I thought it was a pretty relevant video to show. It's one of many videos that have been recently launched on the site, but good to sort of think about as we go through this clinical trial section. I'm just going to really go through a couple of the other parts of this Exploring Clinical Trials section, this new section that's on Duchenne Connect. This is a table that summarizes some of the different phases of clinical trials. We're going to be talking today mostly about mostly phase 2 trials. As I said, there's a video library, so there's more videos in there. It's 15 in total. There is a new clinical trial decision guide that helps you go through the series of steps discussing some of those issues that you have to think about when you are considering going into a trial, and this is a tool to help you sort of parse out those decisions. If you decide that you would like to participate in a trial, there's a trial finder to help you locate the trials that you might be eligible for. And this is one that we curate. You can go on clinicaltrials.gov. We actually take information from many sources and try to make it as up-to-date as possible. So as you said, you can search alphabetically, you can search by ambulation status, corticosteroid use, mutation-specific trial. So there's a bunch of different ways you can search for a trial. And if you have any questions, our Duchenne Connect team is here, or myself, and we can definitely help you.